Speakers today. We have Dr. Mary Haas. She's a chief resident at the University of Michigan, St. Joseph Mercy Hospital Emergency Medicine Residency in Ann Arbor, Michigan. Following residency, she will be a medical education fellow at the University of Michigan. She has previously served as the president of AAEM RSA and currently serves on the board of directors as the immediate past president. She is also a member of Allium and Feminine teams. So thank you, Mary. We also have Dr. Rachel Solnick. She's an emergency medicine resident at the Yale School of Medicine. She serves on the EMRA board of directors as the health policy director. She has previously served as an advocate for medicine at national and local levels through positions as the vice chair of the Texas Medical Association Medical Student Section and on the governing council of the AMA's Women's Physician Section. Thank you very much, both of you, Dr. Solnick and Dr. Haas, for being here with us.
Thanks so much for the lovely introduction. I'm just going to go ahead and switch over to our slide set here. All right, so thanks everybody for being here. We are super excited to have you guys here today and to talk about finding your niche in emergency medicine. So we're going to start by telling you guys a little bit about us. You can kind of hear our stories and how we ended up in the niche that we're in. So I'm currently a fourth-year resident and chief resident at the University of Michigan, and I actually grew up in Michigan. I got interested in emergency medicine pretty early on when I went to undergrad at Penn and started doing research in the ED. Totally got bitten by the EM bug and knew early on going into med school that I wanted to pursue a career in emergency medicine. So I went on to med school at the Loyola Stritch School of Medicine in Chicago. And I first got involved in AAM RSA by helping to plan a regional student symposium for med students interested in EM. And this was really cool because I met a lot of other friends and peers from other medical schools that had similar interests and eventually got roped into taking on some leadership positions early on in RSA. I ultimately became the Medical Student Council president. And then when I went on to residency at University of Michigan, stayed on the RSA board of directors. Initially, I served as the communications chair, and I was in charge of editing and putting out our educational newsletter, Modern Resident. And then after that, I became the education chair, where I was heavily involved in planning the resident track at our AAM Scientific Assembly. And through that, I actually got involved in CORD as one of the resident track co-planners with my friend Nick through EMRA, who is the EMRA representative. And we worked together for 2 years to plan that, which was really awesome. I continued to be involved in RSA and ultimately became the president and now the current immediate past president, still on the RSA board of directors. And that's just been an awesome experience through which I've made a lot of friends and met a lot of mentors. This year, I've been a chief resident and have been heavily involved in the education at my own institution, helping to revamp our didactics curriculum. And outside of my institution, I've been involved in the academic life and emergency medicine team as the editor of the IDEA series, which is a series that highlights innovative things that educators are doing at different residencies across the country to make their didactics more engaging and effective for resident education. So over the last several years, I've developed in these areas of both administration, leadership, and medical education with a little bit of a social media and tech spin. And I'm hoping to kind of combine all that with my developing interest in telehealth and help my institution integrate telehealth, our recent movement toward building a telehealth infrastructure into the residency education. And I'm going to hand it off to Rachel.
Great. All right, so a little bit about me now. So I actually grew up initially in around the suburbs of Washington, D.C. And so from an early age, I was interested in politics just by sense of osmosis, watching like the Sunday morning political shows and from high school as well as during college did a fair amount of student council sort of activities. But when I got to medical school, I was originally planning on not doing any of that stuff in terms of just focusing on learning the medicine, being a med student. But I went to school in Houston, Texas. I went to Baylor College of Medicine, and just sort of living in Texas as what I saw myself as more of an East Coast person, there were some policies that I became aware of about certain women's health issues that I felt like I really needed to take a stand about. And so I kind of got roped into organized medicine just by way of feeling like I needed an outlet for my advocacy desires. So I wrote some resolutions about these women's health issues for the Texas Medical Association as a medical student. And through that process, sort of fell in love with how much the Texas Medical Association really respected the contributions of their medical students groups. And throughout the next years, I got more involved with the medical student section there and eventually became the vice chair because I took a lot of a liking to also sharing that passion for policy issues with other medical students and helping them craft their own resolution ideas. And then in the next year after that, I became also involved from the AMA, American Medical Association, as well, because it's really easy once you get involved with a state medical association to have that filter into the AMA. And there was a new section that had just become changed from a committee to a section in that year that I was interested in. It's a women's physician section. So they were looking for a medical student representative. And given the interest that I had already had from that last year, I decided to go for that. I actually didn't even get the spot until I had applied a couple times over. But once I was on the board, I was able to network with a lot of other powerful women leaders from across the country. And that was a really fantastic experience. In residency, I decided to go into emergency medicine actually pretty late. And I'd already done most of my sort of leadership things with the general organized medicine as opposed to within EM. So I came in as a little bit of an outsider, but I quickly saw that the resolution and policymaking experience carried over really well into the American College of Emergency Physicians Council, and I went as an EMRA representative counselor for my first year. And then in that same year, I was able to find a spot on the EMRA board as their health policy director. And from that position, it actually also gives me seats at a couple of other groups' board tables. So I also, in that capacity as the EMRA board, sit with the Emergency Medicine Action Fund, which is a group of different emergency medicine leaders who work together on pressing regulatory issues. For instance, they're helping to fund a lawsuit about out-of-network balance billing issues. I also sit with the major political action committee for NEMPAC, which is the National Emergency Medicine Political Action Committee, as well as the Federal and Government Affairs Committee. So I definitely keep really busy with it. From within like the women's issues standpoint, I'm still also trying to develop that more by way of research. I was able to get a grant from the AMA Women's Physician section to study gender and racial biases that physicians face while they're in practice. So that's it for me.
Oh, sorry, Rachel, I forgot to show your beautiful slides. So here we go. All right, so down to the meat of the presentation. So now that you guys have heard a little bit about us and our stories, let's talk a little bit about how you can find your niche in emergency medicine. And this can be totally overwhelming, especially because when we're residents just starting out, we're just trying to survive, man. We're trying to find out where the bathrooms are. We're trying to figure out how to use the EMR. So to think beyond that and think about career goals can be really daunting. But you got to remember that it is really important to think about it as early as possible, because that way you can really hit the ground running. And once you do identify your niche, you can maximize the productivity that you have in that area as a resident and really start to develop a nice portfolio for yourself that you can carry and continue to build throughout your career. Emergency medicine is one of the specialties with the greatest breadth of required knowledge and skills, but there's so many small areas that you can choose to focus on. And I'm not going to list all of them, but some of the ones that you can think about include ultrasound, medical education, sports med, critical care, pediatrics, women's health, wilderness med, admin and operations, legal aspects of medicine, QI, research, tox, health policy, geriatrics, palliative care, EMS, simulation, I mean, you name it. And there's probably a lot of them that don't even exist yet that in the future will become major areas of interest. So even if you don't want to do academic medicine, you can still have a niche and choose an area that you want to develop in, because even as a community physician, you can become a really valuable member of your practice by having an area of interest, whether you're the medical director for EMS, whether you're the QI person, ultrasound director, whatever practice that you're in, your niche can prove to be extremely valuable. So you want to definitely start looking for it early. And you want to try a lot of different things and see how you like them. One thing that can be helpful is to look at your mentors and the people that you admire. What kind of stuff are they doing? Is it something where they could kind of pull you in so you could experience a little bit of what their day-to-day is like and see if it's something that you might want to emulate? A lot of this process too will require a lot of soul searching. You really have to ask yourself, what are you passionate about? And pay attention to how you feel when you're doing certain things. When you did that awesome ultrasound, were you super excited about saving that clip and being able to review it later? Ask yourself what really makes you happy and excites you. And it's important to be genuine. You don't want to just pick a niche because you think that just because it's going to provide you a certain opportunity. You really want to love that because people can definitely tell when you're not being authentic. And if your niche doesn't already exist, that rather than a challenge can be seen as an opportunity to create one, because that is by definition what a niche is, something unique that you are an expert in. So if you create it yourself, you know it's going to be extra unique. And once you identify your niche, then it's time to start developing breadth and depth in that area. And it's totally okay to have multiple niches and areas of interest, because this is going to give you flexibility and increase the number of opportunities that are pertinent to your interests. It's also totally acceptable to combine two areas to create a unique niche. So a good example I like to give is in our residency, we have the opportunity to select a particular track. And I know a lot of other four-year programs have this. So for instance, you can choose to do the ultrasound track, the admin track, the critical care track. And one of my friends knew he had an interest in sports medicine, but he also has an interest in ultrasound. And he ultimately decided to take on the ultrasound track so he could really become an expert in musculoskeletal and soft tissue ultrasound, and then utilize that when he applies for a sports medicine fellowship and create a really unique combination in both an expertise in both ultrasound and sports med. And it's also going to be natural for your niche to change and develop. Even if you start out in one area of interest and then later discover it's not for you or find one that you like better, that's just part of the natural process of your professional growth and development, and that's something that you should be scared of. Lastly, it can be really helpful to think about pursuing a fellowship in a particular niche. One of the benefits of doing a fellowship is that it automatically provides you with mentorship. It automatically provides you with structure. And so if you're somebody who kind of needs that extra structure and that those people kind of checking in on you, making sure you're moving forward with your projects, taking part in a fellowship can definitely provide that for you. So moving on to Rachel, who's going to tell you why it's important to identify and find a niche.
All right, great. So something that you mentioned earlier in terms of emergency medicine having incredible breadth of different topics that we deal with on a day-to-day basis. And it can really help you connect with what it means to be an emergency medicine doctor if you can also find something within those breadths of different things that you want to really drill in on. That can help you connect with other people based off of that shared topic. And you can also think of having a niche as something of a burnout buffer. It's getting to be pretty frequent now that I see headlines in my email inbox talking about how emergency medicine continues to top the list, unfortunately, of medical specialties that report high rates of burnouts. So you can think of your niche as something that can provide some other interests outside of work that are still related to work. I've talked to other attendings who are a little bit further out, and they've mentioned to me that they kind of regretted that they didn't have a chance to go back in time and find something else to work on as well. Another thing about having niche is that it can help you create your own personal brand. When you're thinking about looking for a new job or looking to join like a new organized medicine committee, you're trying to also think about like, well, what would this group want in me? What makes me special? What makes me different? What can I bring in terms of added value to the table? And having a niche in something can help really make that an easier question to answer. It also, in terms of having a niche, it helps facilitate networking. When you're just meeting somebody and you want to introduce like what's something that you care about, you're passionate about, what you do, it helps to be able to talk about what sort of projects from your niche you're working on. And it also helps you become an expert in something. If you're interested in doing research, if you want to find things within that niche, then it makes it easier to focus in on what you want to research. to the next slide.
And Rachel's now going to talk about finding mentors.
Yep. So a big part of developing a niche is also finding mentors who can help you within that field. You can think of a mentor or a group of mentors as your own sort of personal board of directors. They can be your sounding board for ideas. If you want to develop within that niche and you have something that, you know, based off of your opinion, you might think it might be a good way to go, but somebody who's had more experience could potentially steer you in a better direction. They can also be project collaborators for you. There's oftentimes when I've had somebody that either it was something that I thought out or it was assigned to me as a mentor, and we were just sort of talking about who we are and what we're interested in, and then a project came out of it. And now I'm working on something with somebody who I really respect. Similarly with that, mentors are really helpful in that they can be your eventual letter writers. Seems like everything that we end up doing within going into a niche these days involves having needing letters of recommendation. So it's really useful to be able to look to people for that. Another thing is that they can also help you make connections with other people. If they don't necessarily do exactly what you're looking to work in, they might be able to connect you with one of their colleagues who would be a better connection. And when you're developing mentors, it's important also to consider having a variety of different experiences in terms of like if it's a community or university doctor, and also different perspectives in terms of years out. Somebody who has been doing emergency medicine for 30 years or somebody who's just a new fellow, they can both provide really valuable different perspectives there. Another thing important about having a mentor is also in setting expectations. One of the phrases that I heard recently about this that I liked was called managing up. So your mentors are very likely, you might think you're busy, but they might be even busier. And so to make it for a more fruitful relationship, it's helpful if you are able to tell them, like, this is, you know, follow up on some of the deadlines that you guys have set together, and just to be really responsive with regard to what you guys are working on. And that's the way to sort of maximize your relationship with your mentors.
So I'm going to talk to you guys a little bit about some pitfalls, and these are some things that I have learned the hard way through personal experience. And these are also mistakes that it's easy to make more than once. So hopefully if you keep them in mind, it'll help you avoid them and make your life a little bit easier as you develop your niche. So the number one most important thing, and the thing that myself included and many of us are still struggling to learn, is not only to know when to say yes, but to know when to say no. And this can be a really hard question to answer. You'll notice the pie chart on the slide here. And the point of this is to represent the fact that as residents, and even beyond residency, our time is really limited. We all have one plate with a finite amount of time on it. And anything that we add to the plate takes away from something else. Some other domain in your life may suffer because you add on an extra project or an extra responsibility. What you don't want to do is take so much on your plate to the point that it detracts from your performance in all your areas of life, affects your wellness, and then you develop a reputation for being flaky and not following through. And this can be hard to shake and can make you miss out or lose out on some really great opportunities. So there's a few criteria I like to keep in mind when I'm figuring out, is this opportunity worth saying yes to? And the first thing I ask myself is this particular project or opportunity in line with my values and my goals? If not, then it's not worth taking on. The second thing I ask myself is this opportunity related to my niche and area of interest? And it doesn't have to be, but it definitely helps for you to have a clear interest or clear focus when people are looking at your CV, and make it appear that you're not necessarily scattered, but that there's some theme that connects the things that you're involved in. The third thing I ask myself is this opportunity offered by people that I admire or want to work with who have a track record of getting things done? Because that increases the likelihood that I'm going to enjoy taking part in it and that it's actually going to come through to fruition. I also want to know, does this have clear expectations for a time commitment and a timeline so that I can know how long I'm going to be working on it and know if it's realistic for me to take on? And then lastly, it's important to ask yourself, will this opportunity offer a tangible goal and benefit? And in the traditional sense, the gold standard for academic currency is really publication. So obviously it's always great to get a publication out of something, but it doesn't have to be a publication. It could be the budding of a relationship with a mentor that you want to continue working with who can open doors for you. It can be putting on a really awesome event that you're proud of. It could be any number of things, but you should know what the end goal is, and it should be something that you can concretely say that you accomplished. One thing that can help you figure out when to say yes and when to say no is to join a group of academically productive people who share one or more of your interests. So for instance, at my institution, we have a medical education research group that meets 1 to 2 times a month. And this provides a space for us to talk about our various projects, to give each other feedback, and to figure out areas where we can collaborate. And it exponentially maximizes our productivity as a group because we all pull each other into our projects. So this can help you figure out if it's coming from that sort of a group, then it's likely something that you can say yes to. Another pitfall you might find is just getting yourself stuck, whether it's the wrong project or the wrong mentor or team. Eventually this will happen in your career, whether it's residency or beyond. And some of the ways to tell that you're just kind of stuck is if you find yourself doing a project that you just don't enjoy. Maybe it feels like busy work, and maybe you can't really identify what tangible benefit you're getting from, and you feel like it's detracting from time that you could be spent doing something else that's more valuable. And this can be a really tough situation to navigate, and this is why it's so important to know when to say yes and say no, because if you can think ahead whether or not the project or the opportunity meets those criteria I previously discussed, you can hopefully avoid this situation. But sometimes you can't, and you find yourself stuck in the wrong project. And if you do, I find it's always best to communicate with your group, let them know early on if you can't complete the project, and ideally find somebody who can be your replacement. And then at some point in your career, you also may find yourself working with the wrong mentor or team. Some of the clues that could suggest that might be that you just don't really jive with the team. Perhaps the team or the mentor don't really follow through. Perhaps they're not responsive to your emails. And pay attention to these feelings and be honest with yourself when the working relationship is just not working. And if you need to, seek another mentor or team that fits you. You're much more likely to be productive in a given area if you like the people that you're working with and it's a positive team. The other thing that often gets overlooked is make sure that you take the time and thought to be original and to come up with your own original ideas. Oftentimes when you're starting out as a resident, developing in a certain area, you get pulled into all these other people's projects. And it's great, especially when they come to fruition and there's an end product that you can be proud of. But make sure that you really take that time to think about the things that you wish existed that don't exist yet. Because that is how you can really create your own niche, is to be creative and come up with something that doesn't yet exist, but that would benefit a lot of different people, whether it's a foam resource, a new knowledge, a research study, a new clinical technique, a new group or community. Just make sure that you keep an eye out for the things that have the potential to be created and to be really valuable additions to what already exists. And I'm going to hand it over to Rachel.
Those are some really excellent ideas there. So something that I want to talk about, though, is that things don't always go really as planned. And that's totally okay and a really normal part of developing your niche. So Albert Einstein, as quoted on the last slide, definitely a successful person, had actually been rejected from when he applied to his doctorate at the University of Bern. And went on then, of course, to be like one of the smartest people in the history of academics. Another person, Cindy Crawford, America's first top supermodel. She was originally rejected from another modeling agency. So you are in the footsteps of really successful people if you happen to fail along the way. And if you just consider it as just part of the process, it really can help you learn from those times that things don't go as planned. So take, for instance, I had previously applied for a departmental grant to do a study, and that was a really arduous process that involved things like making an NIH biosketch. I'd never done that before, and eventually I didn't get the grant, and I was kind of annoyed that I'd put in a lot of time to do this biosketch, but then lo and behold, the next grant that I was applying for also required that same biosketch, and by that time I'd already written it all out and was familiar with the process. And it helped me refine how I was doing my applications. Another example is also with leadership positions. Oftentimes, like I had mentioned earlier on, I had actually applied for that women's physician section like 2 times prior to actually getting it. And each time I did that, I learned how to strategize better in terms of presenting myself and also what sort of experiences I need to get along the way to become a better candidate. So it can just be part of developing yourself within that field. And there's also there's like a wealth of different places to develop yourself academically. So take, for instance, if you have a project that you want to present at a conference and you don't get accepted to one conference, there's always another conference just down the calendars. So there's definitely lots of opportunities to get back in the game in case you fail at some point. And another thing, and this is actually something that I picked up from the Feminine EM conference, was the importance of getting a fail buddy. It's easy to beat yourself up when things don't go as planned, but it really helps in the process if you have somebody that you feel comfortable to talk with them about. I find that this is often what happens in my residency lounge. When I'm in there after shift, like finishing up some notes, inevitably another resident will come in, and then I'll get a little bit of a discussion, whether I was interested in it or not, a discussion about things that like didn't go good during the shift. And it actually ends up being really therapeutic, I feel like, for both of us to be able to talk through some of those experiences together. So with that, the next slide, we can just move on to that next slide.
Yep, the Ready Set plan.
Yeah, thanks. So now that we've talked about all this background in developing your nations, so you're ready to launch into your special fields. So how are you going to do this? There's a lot of different ways to approach this, and luckily, emergency medicine is just exploding with different opportunities right now. Something that can help you to know what's out there is by keeping a really wide open radar. One way to do this is by having a Twitter account and selecting people to follow that are doing things in your area of interest. Twitter also has a thing where it gives you recommended people, so you can develop a really good network of people you follow, so that when you go onto your timeline, you're essentially getting like a live streaming conference of things that are going on and the cutting edge really within that field. Another thing that you could do is stay on top of what's going on within your chosen academic field. So take, for instance, I'm a member of ASAP, and I get the annals delivered monthly. And I can really say that I would probably not be as motivated to read through what's going on in terms of what's being published if I had to go online, but getting the magazine to my house really does help me stay on top of what's being published. Another thing is signing up to the email listers of different industry news. One place that you could check would be like ASAP Now, or also like Medscape. They say a lot, and you can click within those newsletters to hear about only specific fields that you're interested in. And also, of course, networking. When you go to these conferences, there's inevitably a lot of happy hours. Definitely use that as a chance to chat with people about what's going on. Part of this networking is also having a maintained elevator pitch. And don't think of this as a way of like trying to sell a product or sell it yourself, but more of as a way to talk about what you're interested in and what you can bring to a potential new relationship. And another part of that is also having an updated CV. We get so busy in residency, it's easy to get involved in different committees, projects, and forget that we had even done that. So just a nice way to keep that on record for yourself is to keep your CV updated as you go. So now that we talked about ways to find what opportunities are out there, what are some of the organizations that you can look into? So Mary and I have talked about our specific organizations and some of those opportunities within them, but there's also things like SAEM is building up their new section for medical students and residents, and that's called RAMS. That's something to look out for. CORD is also strengthening its ties with EMRA, and that's also opened up a lot of different committee positions. AEM, RSA as well has a lot of really awesome opportunities within their board. EMRA, of course, as we've mentioned, and also ASAP, and then not to forget also opportunities on a local level. States, chapters of either the Medicine Society or also your Specialty Society are great places to connect with. And if you're feeling like, well, I'm missing out because my institution doesn't really happen to be really involved in these different specialty organizations, like what can I do? Well, definitely don't be deterred by that, because if you get onto these email listservs, that can be a really pretty great way of staying up to date with some of those opportunities. It's just a matter of keeping your radar open. And with that, I think, yep, we're open now for questions.
I loved what you said about trying to make sure that you had some space for original ideas. I think that's really tough for people with really busy schedules. How do you try to give yourself that mental space to really kind of clear your mind?
That's a great question. I think that one of the best ways to approach it is to approach it with the space of an inventor. Kind of always have to be thinking and reflecting, what do I wish existed that doesn't already exist? So if you always approach your day like that, eventually you will think of a good idea. And then I think every so often you just have to kind of take some time for yourself to just reflect. Maybe pick a certain day or time of the week where you're just going to kind of think about what you did that week, what you liked, what you didn't like. And taking that time to reflect will kind of help you make sure that you are being intentional in what you take on and intentional about using the experience that you have to help you be original by reflecting on what you wish existed that doesn't.
That's great advice. Any other questions from the audience?
Not right now for me.
Yeah, I don't have any questions either, but thank you so much. Good information provided.
Yeah, thank you. I appreciate it.
Does anyone in the audience have any personal anecdotes or any other advice they want to share that maybe we didn't touch on in the presentation?
I love the idea of when you realize that you have gone down the rabbit hole of getting involved with a project that you desperately should not be involved with. I thought that was great. I think every professional has ended up there at some point. And I really love the advice of being very transparent of, wait a minute, this is not what I signed up for, or this is not quite right.
Can you guys hear me okay?
Yep.
Yeah, so I think the advice of being reflective and taking time to sit and think about what is not out there, and I guess it was Mary that said that, but whichever of our speakers, it's phenomenal advice. And then reflect on lessons you've learned, on your failures. I see failure as a mechanism for rapid cycle improvement and truly failing forward. So I think that that taking time to be really cognizant of the things that have not gone well, and then and to use that to learn and iterate, sort of better the next time, was a great point. And I think it's one of the things that's sort of underutilized in academics today, is really being deliberative about what has gone not just well, but maybe even more importantly, what has gone poorly, and how do you fix that in the future. That's a great tip, and I think it really needs to be amplified.
Definitely. And just to give credit where credit's due, that was actually Rachel's point about taking time and space to be original, that she had come up with an original outline. And I thought it was a really good one too. And I also love what you said about making sure to learn from your failures and to expect failure rather than fear it, because it really is part of weeding out what you don't like, and also just learning how to be better in the future. So.
And I definitely love that phrase, failing forward. I'm totally going to use that in a future talk about this. Thank you, Chris.
I take no credit for that. It's actually a book by Marshall, which is in the business literature, and the whole book is entitled "Failing Forward: Turning Small Mistakes into Large Successes." And I think they're certainly, you try to pull stuff out of where you can, and that book really was career changing for me in the way that I viewed failure. And I think most successful people do that. They view failure as a necessary ingredient in success.
I can't remember if it was Thomas Edison. I think it was Thomas Edison has a great quote. "I've never failed. I've only found 1,000 ways that didn't work." And I think there's a lot of truth to that. Of whether you title it failure or not, something not working is really important, and that it's so pejorative, that word failure is very harsh. But I think it's valuable to not be afraid of it. And I think you're exactly right. The failing forward is and integrating basically the expectation that the first iteration will fail is really important.
So, hi, this is Alice. My biggest fear right now, so currently I'm doing simulation, but I really love research and just the human body in general. My biggest fear right now is closing the door too early. And I love your slide about productivity. So I'm curious to know, when do you guys know when is the time to, obviously, if you don't know what it is, how do you know that you don't like it? Do you know what I mean? That's the problem that I'm facing right now is, I feel like I need to at least take a look at it, but yeah, I only have so much time per day to do that. I'm wondering if you guys have any thoughts on that.
I think that's a great question. I think many people share your same fear. And I think it's easy too, when you're kind of just starting out looking at things, to feel like they're totally separate and that there won't be any overlap between different interests. But oftentimes you can find ways to combine your interests in two separate areas. Like I was talking about my friend who had an interest in both ultrasound and sports med. And for me, the interest in both telehealth and medical education. You might think that those are totally disparate ways, but if you look hard enough, you actually can find the intersection. And remember that it's never set in stone. Even if you find yourself going down a particular pathway, it's never too late if you find something that interests you more. And that you can definitely be an expert in more than one thing or have more than one niche. But I think if you really find yourself passionate about something, don't hold back on exploring that because you're too afraid to close the door on something else.
Mm-hmm.
I think also when you explore that intersection, you become the one expert in where those two things get married, which is amazing.
Mm-hmm. Thank you.
Yeah, I also agree with the point of, I know this talk is about having a niche per se, but it is useful to have a couple of different interests, because that allows you to be agile and responsive to potentially different opportunities that might come up. I think an example of that I had was, I was very interested in like women in medicine and women's health issues, but I also am interested in a lot of just general health policy things. But it wasn't until there was a funding opportunity for a research question I was really interested in that I was able to revisit that past interest and sort of reignite that. So keeping things on the back burner is definitely something that's an option, even as you develop a different niche.